All right. Welcome to Let's Stay Together Talk. I'm your host, Reverend Rick McCain, along with my baby, my girl, my boo, author Brenda McCain. How you doing, baby?
I'm doing great. Feeling good, getting some exercise.
All right, getting our motivation mojo on.
Yeah.
All right, so what you got for me, baby? I missed you this morning.
I missed you all day, too. But
All
I'm
right.
doing good.
I can't smile without you.
Oh.
Can't smile without you.
Pick it up a little bit.
I'll sing a little later at the show. Okay.
Mm-hmm. Well,
What we got?
Thank you, baby, for serenading me. Hello, Tracy Howard.
I
How you
was
doing?
just getting ready to say, ain't nobody gonna say hello to me.
I always say hello.
Hey, me,
Yeah, I was
how you
getting a little
doing?
worried because y'all was over there loving each other, and I thought y'all forgot all about
If
me.
loving you is wrong.
Well, they on hiatus right now, the TV show. But anyway, welcome to the McCain Train this Tuesday. We got a great show for you today. We're going to be talking about men's health,
Amen.
prostate cancer on our first segment of The Next Stop, and marriage military style, the few, the proud. So we are glad you joined us this week to join us on the McCain Train, because to see God's glory, we must share our backstory.
All right.
And our first guest tonight is the lovely Michelle Braccioforte. She is the Director of Research and Education at Prostate Cancer Foundation of Chicago. So I hope some men tune in, because this is really going to be a great, informative show tonight.
Yes, it is. Hey, Michelle, are you there?
I am. Hello.
Hey, how you doing?
How about you guys?
Oh, we're doing great. Hey, thank you
Michelle.
for calling in to Let's Stay Together Talk.
Thanks for having me. I'm really looking forward to this.
Yeah, you know, as a man, and you're talking about prostate cancer, and I looked over your information, and I'm like, this woman is so intelligent. I mean, she's got to be able to help us men out. So,
Help 'em, Michelle.
hard-headed
Help
men
them.
out there that are listening, you've got to listen to this young lady to discuss about prostate cancer. I guess I could say it to be helped too. Prostate cancer. So, Michelle, you know, people are aware of prostate cancer, but some men, you know, we're just kind of naive, and we may not exactly know what prostate cancer is all about. So can you give us a brief bio about prostate cancer?
Sure. Well, the prostate is a small gland that men have. It's about the size of a walnut. It's under the bladder, kind of in front of the rectum, and the tube that we urinate through is called the urethra. It runs right through the middle of the prostate. And so the prostate produces a fluid that's secreted at the time of ejaculation. So that's the whole purpose of the prostate gland. And when someone gets prostate cancer, the cells in the prostate grow out of control and it becomes cancer. And so it has the potential to spread to other parts of the body. And so we want to contain it or treat it if you do have prostate cancer.
So you just said something that kind of got me a little nervous here because you said, where is a gland on both sides of your is it anywhere next to your hip area?
It's not really in the hip, so it sits under the bladder in front of the rectum.
Okay.
And so
you know, the
that's
reason why I was
why
asking is
when-
because I had like a pain down there the last couple of
Always
days,
get
and I'm
pains when
like,
we
you know,
get a
hey,
doctor
you know,
on here.
hey, I've got an educated woman on here, so I want to know.
Right.
So it was like a pain there. So I mean, I would guess that it's going away, so it probably isn't that, but. You know, we're not as knowledgeable. So say that again. I'm sorry, I cut you off.
as far as where's the prostate, it sits under the bladder in front of the rectum. And so oftentimes you'll hear, or a doctor will say, we need to do a rectal exam. And so they can feel part of the prostate by doing a rectal exam. And so that's why they recommend to do that.
Which most men do not like to do, by the way. I remember that, and it just didn't feel, you didn't feel right. I felt,
You was violated, baby.
Yeah, I felt violated. I wanted to call 911 and put a police report in. I mean, but Michelle, this is something that's very important that men need to have, correct?
You know what? It is. And prostate cancer screening is more than the rectal exam. So we definitely recommend you get an annual rectal exam, but we also recommend a PSA blood test. And so that's not invasive at all. You can have that drawn when you get your cholesterol checked or your blood sugar or anything else. So it's just a blood test, but it's the best test we have right now. And an elevated PSA could indicate prostate cancer or something else going on in the prostate. So for screening, we do recommend a PSA blood test and the rectal exam together.
Okay, but before we get to all of that, because I really want to dive into that, what are the signs that a man could look for? Because as you know, my husband was thinking, okay, he had a pain in the side of his hip, so give them some signs that they need to be more aware of.
Sure. Well, early-stage prostate cancer actually does not have any symptoms. And so that's why we recommend the screening, because in order to diagnose it early, you wouldn't have symptoms. Now, once a prostate cancer becomes more advanced, you can definitely have symptoms, including pain and stiffness in the lower back, the hips, just like Rev. had mentioned. It doesn't mean that that's prostate cancer, though, but that could be a sign of advanced prostate cancer. And also urinary changes, like difficulty starting and stopping urine. Sometimes patients will complain about waking up frequently or having pain when urinating, painful ejaculation, things like that. But all those things I just mentioned can also be caused by things besides prostate cancer. So that's why it's important to get screened to determine the cause. Because if a man has an enlarged prostate, which could be benign and not cancerous, they can still have urinary symptoms. And so if you're having any symptoms, it's definitely important to get screened by a doctor. And if you have an elevated PSA or an abnormal rectal exam, then they might recommend further testing, like a biopsy.
So, Michelle, so you're basically saying, that there is no early warning signs for prostate cancer. And so that makes it even more important that men should get this done regularly. What age do you say that a man should start getting regular prostate cancer exams?
Yeah, so we recommend starting to get the screening at age 50. However, if you have a family history, so if you have a father, brother, son especially, we recommend starting at age 40. And if you're African American, definitely start screening at age 40, because African Americans do tend to have a higher incidence of prostate cancer.
Is that one of the risk factors? Well, name some of the risk factors then.
So risk factors, age definitely. Sometimes you hear some people think, prostate cancer just happens to older men. And that is true. The older you get, the higher the risk is for prostate cancer. But we've seen patients in their 40s, 50s, and nowadays we're living longer. So, we need to get screened, and if there is a prostate cancer, get treated so that you can continue having a good quality of life.
Does diet
so age, yes. So besides age, obviously diet, and that goes for every cancer, not just prostate cancer, all cancers across the board. A healthy diet and exercise are so important in preventing cancer, because we don't know the exact cause, but we do know that people who are healthier in general have less incidence of prostate cancer. And also race, as I mentioned. African Americans do tend to have a higher incidence of prostate cancer. And so if you're getting older, definitely starting at age 50, get screened. If you're African American, start earlier and try to maintain a healthy lifestyle. Those are the only things that have really been proven to be true risk factors for prostate cancer.
So, unfortunately for me, I've known some people who have passed away from prostate cancer, and a lot of times what happened was that the person wait too late, or they don't get examinations at all, and then when the system comes up and then they find out that they have prostate cancer, they start a treatment then. For those who may not know, is prostate cancer curable?
Yeah, so I'm glad you mentioned that. A lot of people are waiting. A couple of years ago, the U.S. Preventative Task Force came out with new screening guidelines, and they suggested people hold off on screening. It leads to unnecessary biopsies and treatment, and we shouldn't do it. And unfortunately, what we're finding is that, just like you said, we're seeing more and more men coming in with advanced prostate cancer. And advanced prostate cancer is not curable. It's treatable. We can contain it, but we can't cure it. But early stage prostate cancer is very curable. And so we at Chicago Prostate Center, we still recommend screening for men and early diagnosis and treatment. It is very curable. If diagnosed early, a low-risk prostate cancer patient has a 98-99% chance of cure. I mean, that's excellent.
Yeah.
But once it spreads, it's not so good.
Yeah, I'm taking over this thing now because I'm looking at this picture, and I'm looking at where they got the prostate thing on it says right there, and I was getting the pain there. So it's kind of bothered me just a little bit, but, in Jesus' name, I'm not going to get too upset.
Yeah,
but,
if you haven't already been screened, definitely get a PSA test, have a rectal exam, and just kind of keep an eye on it. You want to have a baseline so if you get an annual screening, kind of how things are changing.
Yeah, well, you might be talking to me again, Michelle, but Tracy's got a question for you.
Yeah, I have a question, Michelle. Just like with women, I know they have the tests where if it runs in your family, they can give you those tests to see if you're predestined, I guess is the right word, to having it. And also we can have our breasts removed. Does that happen with prostate cancer? Is it any test you can have to see if you have a history for it? And is that something you can remove?
Yeah, there's all sorts of genomic testing, genetic testing, things like that are kind of being studied in different phases. None of them are really prime time. Not that I know of, we do not recommend any sort of prostate removal or treatment unless you have a diagnosis. So I don't know anybody who would, treat a prostate gland with radiation or remove it with surgery as sort of a preventative measure. I don't think that they're doing that.
And I appreciate you saying that because you've got so many people out there that are doing different things that are not sanctioned to be done. And so someone to hear that, to say that, that you be careful about where you go to. Go to somewhere where you know that it's a sanctioned place. What would be the word I'm looking for? It wouldn't be FDA approved. What would be the approval code regulation for this?
Yeah, I know what you're trying to say. I mean, I think I would say, I don't really know exactly the word, but definitely someplace that is reputable, someone who has experience. You want to check it, just like if you're having your house remodeled or something, you want to get references. You want to talk to patient references. You want to see their results. You don't want to just take their word for it. You want to go to somebody who has a lot of experience and who does this every day, and that's what we do. This is what we specialize in. We treat prostate cancer. And our medical director, Dr. Brian Moran, has been doing this for over 20 years. He's treated thousands and thousands of patients. We have thousands of patient references that other people can talk to, but definitely, and more importantly, we track our results. So that's really important when a patient comes in and says, what can I expect as far as side effects? What can I expect as far as cure rates? We're not just quoting other people. We're quoting our results. And so we can say, this is our experience, and this is what we expect you to have. And so we're really grateful that we've been able to track all of our data and to really be able to help our patients in that way. We've treated over 15,000 patients.
Michelle, what type of treatment can a patient expect once they've been diagnosed with this type of cancer?
Yeah. Interestingly, with prostate cancer, there's so many different kinds of treatments, but the most common and the three most common are seed implants, there's surgical removal, and there's external radiation. So the seed implants, which is actually what we do at the prostate center, are where we implant small radioactive seeds directly into the prostate, and it gives off radiation to kill the cancer. And then surgery is surgery, so it's surgical removal of the prostate gland. And then external radiation is IMRT, and that's kind of what people picture going into, laying on a table, and the machine shoots radiation into the prostate, and you go in every day, and that's what external beam radiation is. And those are the three most common, but there's numerous prostate cancer treatments out there.
So, Michelle, what you're saying is very interesting. You said that you put seeds into the body, and that has like a radiation effect. Explain that a little bit, because that's very interesting.
Sure. So it's called low-dose rate brachytherapy, or seed implant. You might hear someone say, "Oh, I had seeds," or "I had an implant." And just like I was saying there, we implant small radioactive pellets or seeds into the prostate gland, so we're avoiding all the critical structures around the prostate. And over time, it gives off radiation and it kills the cancer. And the cure rates are excellent, 98, 99% for a low-risk patient. And it's one time, it's an outpatient procedure, there's no incisions or stitches. And we've been doing it for over 20 years at our facility, so they do really well.
That's when you detect it early, I gather, right?
Yes. Once it's more advanced, then we incorporate other treatments into the seeds.
I have another question, and please forgive me if we already said it, and it kind of went over my head. You know, being a woman with all daughters, what the heck does a prostate do?
Yeah, so the prostate is the gland that creates prostatic fluid. And so when a man ejaculates, the fluid that the fluid that carries the sperm, that's fluid from the prostate. And so it's essential for reproduction. It's not a necessary part of the body if you're not intending to reproduce, but that's what carries the fluid, the sperm, at time of ejaculation.
You know, Michelle, what I love about Let's Stay Together Talk, you know, we're a Christian radio show, but we talk about a lot of things that the church doesn't talk about, and you are being very educational and informable, and I can't even say the word. Informative. Thank you, baby. That's why you got to help me, Michelle. I'm telling you, you know. But you're being very informative about this information. You know, I was just looking at. I'm like, you know, when Tracy's talking about that, how does what? I don't know if we talked about this either, but what causes prostate cancer? I mean, how does a person, I mean, you know, we got to eat right, we got to do this, and in some cases, it can still happen. You know, I don't know if it's avoidable, but is there certain things that if we make sure that we don't do or we don't eat or exercises that we got to be concerned about? I mean, for a man out there like me that might be like really nervous right now saying, you know, what can I do to stop this from happening? And when it does, you know, what is my next step? So tell me about, is there anything that you can do that can stop this from happening? And if not, what would be my next step to avoid any serious situations of prostate cancer?
Well, you know, unfortunately, nobody knows what causes prostate cancer or any cancer, really. And if we did, you would be a billionaire if we could find the cure for it. We just don't know. And even if you do everything right, you know, like you said, eat right, exercise, get screened, track everything, some people still get prostate cancer. And actually a lot of people do. 1 in 7 men are getting prostate cancer. So that's a lot of cancer. And there's really nothing you can do except, like you said, if you want to increase your outcome, your chances of having a good outcome, if you get early screened, if you have a diagnosis, you get treatment at an early stage, that's what's going to give you the best chances of having a good quality of life. Because as long as it's contained to the prostate, we can treat it and you can move on and live your life. But as far as what causes it, we just don't know.
So, Michelle, I need to just say, babe, you need to go get
me and Michelle talking after this show.
Let me finish this, Michelle. My baby need to go get that DRE, which is that digital rectal exam done, and that's very important to let him know whether he has it or not, right?
Yeah, and so, you know, because with me right now, and I'm not trying to bring prostate cancer on me in Jesus' name. I know I'm not. But I know, like, right on the left side of my glands there, just the last couple of days it was hurting. But it seems like subsiding. It. I don't think it goes away and comes back. That's correct, right?
Yeah, usually it doesn't. But, you know, there's a lot of things that can cause pain in the prostate. You can have an infection. What's called prostatitis. It's an infection in the prostate. It doesn't mean cancer. You can have an enlarged prostate, you know, and as men age, their prostates do grow, and so that can cause a little uncomfortable sensation or urinary issues or things like that. So your best bet is just to go see your primary care, get checked out. Your can come to the prostate center where we are. We're in Westmont. We'd be happy to offer you a free screening. We can do a PSA blood test and a rectal exam, and you can meet with our medical director, Dr. Brian Moran. And you know what? And all your listeners, any of the men who are listening right now, give us a call and say you want a free screening, and we'll set you up.
Rick, like I did the breast. Remember when we did the breast cancer?
Yeah, you know,
and I videoed me going there.
Believe me,
me
and like I done said this 3 times. Me and Michelle will be talking.
Yeah,
so
Michelle,
give me. Hey, let me tell you something. I don't want to die. I'm sorry. You don't do that but once. So Michelle, let me give that information out again to everyone so they can reach you.
Sure. So if you want a free screening, we're at Chicago Prostate Cancer Center. It's in Westmont, the west suburbs. And our phone number is 630-654-2515. And the website is www.prostateimplant.com. And like I said, if you give us a call and say, you know what, I heard you on the Let's Stay Together show, and I want to come in for a free screening, we'll set you right up.
Hey, man, I appreciate that.
We need to post that there for the men and let them know.
We need to. We will be.
Yeah.
And group pages and everywhere else. Michelle, here's one of the questions. You know, if I have got to go through past the free screening test and I've got to do more testing, is this covered by most insurance?
Yes, it is. Now, there's so many different plans, and I'm not in the billing and insurance area, but as far as I know, prostate cancer screening, biopsies, and treatment are all covered by most insurance companies and Medicare.
Question for you. What is the Gleason score?
Yeah, I'm glad you asked that. So the Gleason score is so what happens is if you do have an elevated PSA or an abnormal rectal exam and you have to have further testing, we do what's called a biopsy. And that's where we take samples of the prostate tissue, and then a pathologist will look at it under a microscope and assign it a grade. And so that Gleason score is really just kind of a grade that the pathologist sees. So grades 1 and 2 are thought of as normal prostate cells. So they look at the prostate cells under the microscope, and then they say, okay, this looks like a grade 3 or a grade 4. And so a normal prostate cell looks like a grade 1 and 2, and then the worse it is, then you get into 3, 4, 5. And so they add the score together to come up with a Gleason score. So, for example, a Gleason 6 would be considered a lower risk prostate cancer. A 7 would be in the intermediate range, and 8, 9s, and 10s are in the high risk group, or they're more aggressive cancers. Yeah. So it's really a grade.
So, Michelle, as stubborn as men are, and you didn't hear me say that, but as stubborn as stubborn as men are, do you find that most of them are when they come in, they've already have a serious side effect of prostate cancer? I know we're not ones that like to go to the hospital until something actually has happened to us. What can you what can you say to the men out there that are listening right now to kind of get them to realize that this is very important, that you, especially at the age of 50, that you get this screening once a year?
Yeah. Well, like I said, it's not a rare disease. 1 in 7 men are getting prostate cancer, so your best bet is to get screened. It may be uncomfortable to have a rectal exam, but you have to take care of yourself, do what's best for your health, get the blood test, and if you have something that needs to be looked at further, then do it. And it's up to you if you want to get treated or not, but you should know, because a low-risk prostate cancer is very curable, but once it spreads, it's just very difficult and it leads to a very poor quality of life, and it's just not worth it.
Wow. Do women get prostate cancer?
No, women do not have prostate glands, so they do not get prostate cancer. And sometimes a woman will ask, sometimes we'll have a patient's wife come in and say, can my husband give me his prostate cancer? And no, the answer is no. Cancer is not contagious. It's not like an infectious disease. It's a disease that can't be spread. And so if a man has prostate cancer, he cannot give it to his wife or anybody else.
Wow, so it only spread within that individual, though?
Yeah.
Okay. Wow.
So
Yeah,
Michelle,
it's not a contagious disease.
so you know, I'm looking online, and you've got so many things on the website and on the internet, and people kind of look at the internet sometimes as gospel, and they shouldn't. And I'm reading things like, you know, 5 foods that you should eat to prevent, you know, prostate cancer, blah blah blah. Should we pay attention to that, any of that stuff like that that we read on there, or should we just, you know, just heed to the word of saying go get checked out?
Yeah, you know, I would say the internet is great, but like you said, anybody can post on the internet.
Yeah.
You can post true things, you can post false things, and so it's a good idea to do some reading, do some research. But if you want to read about cure rates and results and side effects and things like that, I would consult the scientific journals. And you know, if somebody has a specific question on a topic, I'd be happy to send you links to published articles. And that's all peer-reviewed by physicians and goes through a rigorous review process before it can get published. And so, again, you can read things about what to eat, what not to eat, but none of that is validated information.
Right. And I appreciate you saying that. And if you have that information, please send it over, because I know that most of the times, even you know, men try to act very brave, and they hear something, 1 out of 7 men, you know, that would scare most women, and most men act like, that don't bother me. It should.
Yeah.
We should be more, you know, willing to go out and get the screening done, so we can make sure that we have not only a healthy life, but a long life. So Michelle, I thank you very much. You have been so informative. I need you to give that information again. One of the things we always say to our people that come on our show, that once you come on, your family. So we're definitely going to be looking for you to come back on and educate us again about prostate cancer and any other information that you may have. Tell them how they can get in contact with you and the location for the Prostate Center Foundation of Chicago.
Sure. I'm happy to do that. So we're located in Westmont, so it's just in the west suburbs. Chicago Prostate Cancer Center. Our website is prostateimplant.com, and that's one word. And our phone number is 630-654-2515. And we offer support groups for patients, their family members, whether they're newly diagnosed, if their spouse wants to come. We have September is Prostate Cancer Awareness Month, and so we do a whole bunch of events for that, including a 5K run and walk. So there's a whole bunch of things going on. Check out our website. Give us a call if you have any questions, whether it's you, whether it's your brother, it's your dad, it's your cousin. You know, if anybody has any questions or concerns about prostate cancer screening, about a biopsy, about treatment, please call us at Chicago Prostate Cancer Center, 630-654-2515.
All right. Well, thank you again, Michelle, for being on Let's Stay Together Talk. Man, what is wrong with? I'm thinking so much about prostate cancer now. I can't even talk.
You need to you need to call us.
You know,
come over.
Michelle, you don't have to worry about me calling, because Brenda just wrote me a message saying we need to make an appointment. And so when I said you're going to see me, you're going to actually get a chance to see me, because she might take me like my mama did and grab me by my ear and make sure I go.
And I would love to see the lovely Michelle, so I'll be talking to you privately, Michelle, to see if you're going to be there.
Yeah, so we'll definitely.
I will be.
We'll definitely be
please
there.
Give us a call.
Yeah. Again, thank you very much for sharing that information. It has been great, and I hope everybody out there has learned something. I know I have, and I will definitely be seeing you soon, and you'll definitely be back on the Let's Stay Together show.
Hopefully in September. That's their month.
Hey, Michelle, you know you're gonna be. You might as well put September on your calendar. We might get you in there before that, but mark down. Let's Stay Together wants me in September, so we want to grab you before someone else does.
That sounds good. Thank you so much for having me.
All right,
I look forward to meeting you both.
All right, thank you for calling. We'll talk to you soon.
All right,
take care.
Have a good night.
Bye-bye.
Bye.
Hey, baby, what we doing next?
Oh, coming up next, we have the POV Point of View by Donna Terrell and EBE, Exotic Body Essentials.
Right, this is Reverend Rick McCain along with my baby, my girl, my boo, Alta Brenda McCain. Wow, I am really messing up. We'll be right back after these commercial breaks, and I can get a voice and talk right.